My next question for you all is, how are they similar and different? And if someone could also talk about, when you say neurodivergent, what does that mean?
I can take that one if you want. I think if we stay a little bit further back from the mic, we can do it without the feedback.
Okay.
Can Zoom land hear me okay, hopefully? Okay. And could you please rephrase that question?
So yes, I rambled a little bit. I wanted you to talk about how are they, well, first, why do we use the term neurodivergent?
Yeah, I'd love, yes. So in the 90s, a term was coined neurodiversity. And that term came into existence to push back against the myth or the misconception that there's such a thing as a normal brain. There are variances in brain capabilities and the way the brain works throughout the human species. This is normal and healthy. It's just a part of the human condition. But this idea that there is a perfect or baseline brain, that if you, the more perfectly you fall upon this, the more good you are as a human. And if you vary from that, you're somewhat defective or lesser. That's a bad way to think about it. It's not scientifically a very accurate, it's actually a very inaccurate way of thinking about it. And so neurodiversity was just to call attention to the fact that brain differences are normal and healthy, and there's nothing wrong with those. We're all neurodiverse in some way. No one person is precisely identical in their brain to anybody else, right? Neurodivergence is something that we use to kind of apply. I always like to compare and contrast it with, in the autism world, we often refer to people who are not autistic or people who are not neurodivergent as neurotypical. I try to avoid that because neurotypical people do not like being called neurotypical. It just sticks them in a box and acts like, oh, there's nothing special about you. You're just like everybody else. I prefer to use the term Neuro-Majority. My definition of Neuro-Majority is that your brain wiring is similar enough to the majority of people that you can relate and connect and communicate effectively with little difficulty. Of course, people always have misunderstandings and stuff, but you're seeing the world similar enough and you have similar enough experiences that you can kind of relate. Neurodivergent means in one or more ways, you're wired differently enough from most people that you struggle with things that most people don't struggle with, or you might have some gifts that most people don't have. And often with neurodivergence, it's both. So because of my autism, one of the most common features about autism is we have a bit of a social disability. All that too many pathways and stuff, sometimes it makes it difficult for us to read your body language. Sometimes it makes it difficult for us to figure out what could be an acceptable topic of conversation or what could be offensive. If we start straying into an offensive or upsetting line of communication, and you're putting off all those subtle nonverbal signs that says, hey, you should really stop talking about this, or I'm uncomfortable with this, or I don't like where this is going, we're very likely to not get the signal or not get the message. And so social interaction for us is baffling and confusing. From our perspective, we're the only ones who use language the right way because we say precisely what we mean. We're very literal thinkers and we're very literal speakers. But for other people, this means that we can come across as brutally honest or blunt or selfish or narcissistic, when in reality, there's just, we're blunt and direct because that's the only way we know how to effectively communicate. We can't go off of innuendos or wink, wink, nudge, nudge, sarcasm. These are the kinds of things that kind of confuse us. So I'll say one more thing about neurodivergence is that when you are neurodivergent, there are some things that we struggle with that for other people is so easy and so natural that they can't even wrap their heads around how anybody could struggle with this. It's just so obvious. It's just so easy. I do it without any effort at all. Well, that's because you're wired that way. For those of us who are not wired that way, we're missing some of that wiring. I have to work really hard and complex to poorly imitate what other people can do naturally. Now, earning a PhD in physics was not a trivial thing. It took years and years of hard work and effort to get that. But it is not hyperbole when I say it was easier for me to earn a PhD in physics than it was for me to figure out how to have a conversation with a stranger in a party in a positive or at worst neutral sort of way. Like if you don't have all that wiring and stuff that helps facilitate human connection, human interaction and stuff, and you're trying to imitate it, it's really hard and complex to sort of like write the algorithms in your head to just, at my very best, I just do a poor imitation of what other people do as natural as walking and breathing. And from my perspective, so much of what you guys can do looks like magic. And then there are some things that is really easy and simple for me that I have to stop and remind myself that it's not easy for everybody else. A lot of autistic people, we are often superior in terms of pattern recognition. And it is a spectrum, it does vary, but there are some people who can glance at a complex pattern that many of you might take hours to sort of sort through to try to find a variance. They can just glance at it and that variance just pops out to them and is as obvious as a red dot on a blue field. So yeah, I hope that helps clarify.
Absolutely, it does. Thanks, Dave. It's always hard to follow Dave. He's very eloquent and explains things in such a great way. So neurodivergence also, so typically it tends to mean, autism falls under that ADHD, learning differences, even psychiatric conditions can make someone neurodivergent. So as Dave said, it's really an umbrella term that's more inclusive and strength-based to talk about how people's brains are different and how people perceive things in a different way. A little bit further away. And I think typically, we, within the clinical field, try to be respectful of how people want to identify, and so historically, again, from a medical model, thinking about disorders and conditions, and that's important for science and for research, but on a clinical human to human basis, it's also important to know how people want to identify. So people will now identify as person first language in terms of autistic adults, and that's a preference. People also now like to be, identified as neurodivergent, as opposed to possibly autistic or ADHD. And there's a real sense of camaraderie and community that has been really positive within the neurodivergent movement. So I just wanted to add that piece. I don't know if anyone else. And then in terms of the similarities or differences with autism and ADHD, so both can cause social difficulties. I think the biggest difference between autism and ADHD, they're both neurodevelopmental disorders. They start early in childhood with signs and symptoms. ADHD is really the attention and hyperactivity and impulsivity first, that then might produce you're not paying attention in a social setting, so you're missing social learning opportunities. And so ADHD can certainly cause social problems, as well as behavioral difficulties. We see individuals with ADHD that do have motor stereotypies, which are, more often associated with autistic individuals. So there are behaviors that do overlap, there's symptoms that overlap, but really the defining feature of the attention and hyperactivity without these circumscribed interests, these really intense interests that people with autism have, or sensory differences, or kind of the social quality of their speech. So there's specific qualities in terms of how some people with autism speak, in terms of their prosody or their patterns of their voice or their nonverbal behaviors. Typically, those are absent in individuals that have ADHD. So those are some of the kind of more distinct features that might differentiate the two conditions. Do you want to add?
Yeah, so the only thing I'll add to that is we're talking about differences and similarities, and often they can co-occur. And especially in my work at the University Counseling Center, we might have a student who's coming in with concerns about ADHD, but in the context of that evaluation, there are characteristics of ASD, and so we might do further evaluation down that lane. In the college setting, often, or years ago, it was like, well, we don't have autistic individuals at Vanderbilt. And as we've begun to do more assessments, because most people think that it would have been identified earlier and that those students might not have come to college, but I don't have stats on the actual prevalence here, but at the University Counseling Center each year, we are receiving more and more referrals of students who have begun to learn more and, done some self-introspection and noted that they have some similar characteristics. So our wait list is growing for students who are first becoming concerned about ADHD and or ASD. Right. And I think there was a question on prevalence. And I'll start with ADHD. For children, it's about 10%. For adults, it's about 3 to 4%. And for college students, it ranges from 2% to 16%, depending on the college university. Here at Vanderbilt, just based on the statistics we have we've gathered from the Office of Student Access, there are about 5% of the student population who have registered with that office who have ADHD specifically. So that's probably an underestimate, because there may be students who have ADHD who are, receiving treatment and managing it well. And maybe they're at a point in their academic career where they wouldn't benefit from traditional accommodations. And so they've just they've chosen not to disclose that.
I would have a follow-up question of sorts. So I am new to TikTok. That's where I get a lot of my information from. And one of the things that I've noticed is that there are a lot of adults who have children that have been diagnosed. And now the parents are being diagnosed because they find out that the issues that the child has are also things that they do as well. Can you speak a little bit about what that means and why it's happening now versus 10, 15 years ago?
Sure. I think one characteristic, in both autism and ASD, in both autism and ADHD evaluations, an important part of the diagnostic process is the clinical interview. And because these are developmental disorders, often we need to talk with parents about the student's early development. And in that line of questioning, parents will begin to think, oh, well, I was like that. I thought it was normal. I'm very disorganized, so I thought my child got it honestly. But as we go through just that series of questions, and with ADHD, there are about 18 different characteristics, symptoms. And so parents will begin to tick it off for the student and note that they have experienced that themselves, but they just thought it was a part of their own quirk, or, just a part of their personality or the way our family runs. And so I think with TikTok, there's certainly a lot more awareness. And so as students are beginning that process and they're having to go back and talk with their parents, I think that's where we're finding that parents are also relating to the signs and symptoms.
Thank you. My next question is, you've kind of talked about it a little bit, but I didn't know if you all wanted to add anything additionally to, how are people diagnosed? What's the diagnosis process?
Goodness, this microphone is my mortal enemy. So, like with autism in particular, we are always at the Frist Center, we're always getting reached out by adults, not just from Vanderbilt campus, but throughout the country, throughout the world, who find out about us. And one of the most common questions I get from them is, I think I might be autistic, or I definitely think, there's something different about me from other people. How do I formally get tested? Most autistic adults are undiagnosed. There are a lot of autistic adults who don't even realize they're autistic. I mean, they know that they're weird. They know that they struggle with things that other people don't struggle. When I got diagnosed in 2009, it was a shock to me that my weirdness had a name and that there were other human beings out there who go through the same sorts of struggles I did. I never would have guessed. I thought I was alone in the universe. I thought I was the only one wired like me. And at times that could be very, you have difficulty connecting with other people. You have difficulty relating to other people. You share your struggles and people just look at you and go, that's weird. And so you feel like less connected as human beings. Being able to connect with other human beings and have a sincere interaction or connection is absolutely vital for our mental health. When I got my diagnosis, the first time I sat with a group of my people and sat down and heard like my life experiences coming out of the lips of another human being, my world literally changed. Like that is a delineation in my existence, where my existence after was a different existence than it was before. And I did not realize how badly I needed that until I had it. So we're always trying to help people to get a diagnosis. But even if you're like, okay, I think I might be autistic, I want to get out and get a formal diagnosis, it's really hard. You have to find an expert that can diagnose it. You can't just find somebody who's like, yeah, I'm a therapist. I read about autism in a book somewhere. I can give you a diagnosis. You have to find someone who that's their job. They diagnose adults on the spectrum, or they work with adults on the spectrum in a therapy sort of setting, somebody who's like worked with our population enough to where they can kind of notice the subtle signs and they know how to ask the questions, because unfortunately we can't do a blood test or something like that. But the statistics are at least 2% of the population. And if you want to talk about neurodivergence in general, all of those things added together, roughly about a third of our population is in some way, shape, or form neurodivergent. Dyslexia, ADD, ADHD, dyspraxia, Tourette syndrome, all of those things are classified as like of neurodivergent. And as she was touching on earlier, there are a lot of us have comorbid conditions, although when we're talking to people outside of a clinical setting, co-occurring is a much better way to say it. You tell an autistic person comorbid, they freak out. Actually, I think most people would freak out over the word comorbid, but co-occurring it means the same thing, but it sounds so much nicer.
Yes.
So I'm diagnosed autistic. I could probably get an ADHD diagnosis. Like I've talked to enough ADHD folks to go, oh, I have the same thing. And I thought it was my autism thing. And then I find other autistic people who are not ADHD. And I'm like, do you struggle with this? And I'm like, no. I'm like, oh, okay. Apparently I'm not just one weird flavor of human being. I've got more weird flavors. Who knows what all I have? But yeah, certainly, a lot of neurodivergent people out there don't necessarily know what their label is, or don't necessarily know what their tribes are. And I wish we could take better steps to kind of help that, because it's one of the biggest things that's hurting the autistic adults is first, there's not enough resources and stuff out there to help us. So we're just kind of left in the wilds to try to figure it out for ourselves. And secondly, like seeking out for the tools that are out there, sometimes you need a formal diagnosis, and trying to find a formal diagnosis, especially if you're a woman on the spectrum, is extremely difficult to do.
Thanks, Dave. That's okay. And so just, again, a more technical. So typically an evaluation consists of a clinical interview between you and a trained professional. It could be a psychologist, it could be a psychiatrist, some type of mental health professional. And that will include a thorough developmental history. Again, even regardless of what age you are, we expect to see some patterns and signs and symptoms of either social differences or again, attention behavior differences from an earlier age. So we'll do a good clinical interview, then we'll do objective measures. So things called standardized test, which basically is a test that has been tested on a large population of people. There's norms. And so how do your scores on certain measures related to attention or cognition or social emotional factors compare to other people your same age. So there's some normative tests that are done as part of the evaluation. And then really kind of ruling in and ruling out, making a guess of, okay, are there social difficulties or their attention problems because of a past trauma? Or is it because they have depression, which, so there's a lot of psychiatric difficulties that can also derail someone's communication or social functioning. So that's generally what the evaluation will consist of. And there's specific tests, but I won't go into all of that. But there's resources here, both on the university side and on the medical side, where we see kids of all ages and have the professionals and experts here at Vanderbilt for those that are seeking a diagnosis for ADHD and autism. And again, some people want to live just in their world of uniqueness and who they are. And some people do want to label for that validation to better understand themselves, to find their people. And also it decreases some mental health. So people, a lot of adults that Dave was talking about that have gone undiagnosed, unfortunately will, suffer from a major depressive disorder or anxiety, because again, they haven't quite figured out what might be different or what might be going on or why. And so it can lead to subsequent mental health difficulties for people. So that's another reason that motivates people to find a specialist. But we have resources that we can share with the group afterwards in terms of how to access those professionals here, that if you're interested in an evaluation. Yeah.
Just have one thing I'd like to add. I've been in the field for about 25 years, and early in my training, well, after we gather all this information from clinical interview and objective testing, we then compare all of that data to the Diagnostic and Statistical Manual. We're currently on our 5th edition, and the diagnostic criteria for autism spectrum disorder, and just that name, is different from when I first started training and working in the field. And we had more of what we would consider classic autism, some other forms of pervasive developmental disorders, and then this other bucket that was PDD, NOS. It was, non-specified. And so at that time, if this child came in, we were looking for classic autism most times. So persons who had more subtle signs and symptoms often flew under the radar of clinicians, of their teachers, of their parents, because, as we've been increasing awareness of autism at that time, most people, all they knew about it was Rain Man. And so if you didn't have those classic Hollywood portrayed symptoms, you weren't referred for an evaluation. And even when you came for an evaluation, then based on our diagnostic criteria, you may not have received the diagnosis. And so that's why I'll tell people when they look at me cross-eyed, like, you're assessing ADHD and autism in college students, well, wouldn't they have the diagnosis already? But that's probably why their symptoms were so subtle. And because they were so bright, doing so well in school, again, flew under the radar.
Dave, I just want to highlight one thing you said about the importance of getting a proper assessment from an expert. We've had a lot of situations recently where students have come from previous providers or internationally, and just the different protocol for that diagnosis has actually created like a more harmful effect. It can feel like in the short term, trying to get them correct treatment feels kind of like having to backtrack. So yeah, just want to emphasize that. And if a student is to come and want to receive testing, that's an option at the UCC, or Student Care Coordination has a new funding for students as well to receive that in the community within different providers. And then one other thing that I thought was unique about what you said about TikTok and just the family relationship in that aspect. My sister through Cornell recently got tested for ASD and ADHD, and she's always said, ever since I was little, I feel like there's something different about my brain. And so just kind of reverberate, like a lot of what you said, Dave, was similar to what she shared when she received that. And people can receive medication treatment, or they can receive therapy treatment. And there's a lot of different options based on how they want their life to interact with it.
Thank you all for those responses. And Dave, especially thank you for your vulnerability and speaking about it so openly. So my next question, a lot when it comes to hidden disabilities or invisible illnesses, there's a lot of stigma attached to having a label. So some people don't want to get diagnosed because they don't want the label. So as it relates to being labeled, what are some of the benefits of disclosing the label if you're a student, or if you're a faculty member, or if you're a staff member? What are some of the benefits of doing that, but what are some of the drawbacks?
Sure. So one obvious benefit we've been discussing here is you find your tribe. And once you have a label to kind of describe this experience you've had, and you find other people who've been struggling, you can build a sense of community. On the college campus, having a diagnostic label allows you to access certain academic accommodations that are individualized to your particular needs. So if it's ADHD and you have problems with being easily distracted, then you might qualify for being able to take exams in another room that's quieter and fewer people there. In terms of ASD, if there are some social or sensory issues, there may be accommodations that the school will make regarding rooming or housing situations. And so again, that label allows you to access certain accommodations from a legal perspective. Once that label is rendered, there are certain accommodations that you are entitled to. Was there another part of the question?
For faculty and staff.
Okay.
Yeah, and so you can, I work with a lot of transition age and adults, and so you can access, disability income, so if your autism is such, and depending on kind of severity, if you're not able to work, if you don't have your driver's license, you can't get to work. So there's different kind of access and mobility accommodations that require documentation to submit to state services for housing, group homes, again, depending on level. So that's on the more severe end of the spectrum. And then just within your, within HR of many companies, requires a medical note or some type of documentation in order to get sensory accommodations, in order to get like vacation or flexible scheduling. Again, if that's needed, if you are going to be at your best working from home versus in a noisy office. So there's a lot of different accommodations that can be afforded to someone based on your individual profile, your individual needs. Not everyone that's autistic has, acoustic aversions, but many do. So there's all different types of sensory things that can be accommodated within the workforce. And I'm going to pitch it to Dave because this is his bread and butter.
So what should one consider before disclosing their status or accommodation needs and preferences? So there's a couple of things. As an autistic advocate, one of the things I try to stress to my audience, and I forgot to do it, but I do remember sooner or later, is autism is a spectrum. There's an adage in autism. If you've met one person with autism, you've met one person with autism. And that's because if you could really get to know me and how my autism expresses, you can't encounter another autistic person and assume that they're going to be a clone of Dave. Their autism might actually in a variety of ways express themselves kind of differently from me. One of the ways that I'm very atypical as an autistic person is, if you guys can't tell, I have little difficulty being able to speak and verbalize, and I can put together complex sentences and talk. I like to say I'm at the hyperverbal end of the spectrum. That's not that uncommon for autistic college students. Most autistic college students that I've met and interacted with are pretty eloquent, especially the ones here at Vanderbilt, and able to like verbalize quite well. A majority, 40% of people in the autism spectrum are non-speaking. And majority of us have problems with speaking. I actually have problems with speaking when I have sensory issues. I can become minimally verbal or even nonverbal. I just don't normally leave the house or interact with people when I'm in like that. So even people who've known me for a long time, if they've never seen that's understandable. So that's one way. And probably more importantly, I'm comfortable with outing myself as an autistic adult. I'm comfortable with throwing myself out in public and saying, hey, I'm autistic. Here's a chance to like talk and get to know one of us and ask us questions and stuff, because I'm desperately trying to humanize us. But again, that puts me in the minority. Most autistic adults who know that they're autistic are terrified of anybody else finding out that they're not normal. They just want to be normal. And what that means is that they want to be treated the same as everybody else, the same dignity, the same respect, the same opportunities and stuff. They just want to be included. They want to be a part of the group. And they recognize that a lot of people use labels for ill or use labels ignorantly because they don't really understand it. They think it's Rain Man or something like that. And that can be very distressing. It could do more harm than good. So when I'm talking to autistic adults and they're like, oh, I need accommodations, I need this, I need that, but how do I ask because I'm terrified? One of the things I say is labels are really good for clinicians and really good for us to find each other. But when you're asking for accommodations, I strongly encourage you to avoid labels. There's a really high probability that person doesn't accurately understand what that label means, and they're likely to jump to wrong conclusions or something. Stay away from labels, go with descriptors. So for me, there are a number of accommodations I ask for in the workplace and when I'm doing things. One of them is like my sensory issues. So walking up to my professor and saying, I need to be able to wear these headsets because I'm autistic is probably unlikely to get me the accommodation I need. And there might be a little bit of pushback. But if I say, hey, I have a sensory processing disorder and sometimes sounds can become overwhelming or lights can become overwhelming and it can decay my cognitive processes to where I can't function. And I really need my cognitive processes to do well in this class. Is it okay? I know you have a rule against headsets, but I really need to wear some noise canceling headsets. Most professors are going to be like, yeah, of course. Because I didn't just throw a label and expect them to capitulate. Like I explained it, described it in such a way that kind of made sense to them. Most human beings are actually helpful by nature. And I think one of the reasons why they resist helping us because they don't understand how or why. And if you give them that, it's been my general experience that the vast majority of human beings I've interacted with are actually quite accommodating if you just find the right way to kind of explain it to them. So yeah, I hope that answered that question.
It did, thank you. So we're nearing 3 o'clock and I want to make sure that we're where we're supposed to be at that point. One of the questions that I have for you all is, how can we, or they who are not a part of the neurodivergent team, how can they be better allies for those who are neurodivergent? Whatever space that you fall under.
So certainly respecting differences. So in a workplace or in a classroom, you might be observing that someone's doing something differently. You might not be sure why, but just respect why they might be doing it differently, why they might be walking around the back of the classroom or getting up and taking frequent breaks. So kind of just observing without judgment, I think is one way to decrease stigma. We all kind of have different ways that make us a better learner, a better worker. And so that just kind of in your general way of operating is observing without judgment. You just being respectful of, language that's being used, sticking up for the right language within, a break setting, and asking that person, what can I do to help, or what can I do to make this more comfortable for you? Or just kind of looking out for people and figuring out signs and ways to be helpful. But I don't know if anyone else wants to jump in. And I mean, not disclosing if that person doesn't want to disclose. So, you might know that this person might have ADHD. You might know that they get accommodations or have someone that's taking notes for them in a class, but they might not want everyone else to know. And so obviously just keeping privacy where it's due.
Yeah, this is probably one of those things that I always bring up every group thing that I talk to, every company that I talk to when we're advocating for autism in the workplace or better accommodations for neurodivergent folks. I like to stress, I think this is something we can all do just to try to be better human beings. Look, sometimes you see somebody else perform an action or say something and your first immediate thought was, oh my God, how on earth could that person have possibly said and or done that? And then it's very natural for us to go, well, what kind of mindset would I be in? The only way I could have said that is if I was a colossal jerk. Therefore, this person is being a colossal jerk, and then you hit them with anger. I submit to you, that is a terrible way to human being, especially if you're in a situation, especially once you become aware that not everybody's wired the same way you are. That person might be wired very differently. Try to give the benefit of the doubt. Try to be a little patient. Try to ask some clarifying questions. Sometimes someone's being rude to you because they are trying to be a jerk, and you should handle that appropriately, but don't just assume, don't just jump to that conclusion. That person could be neurodivergent. I've always, the thing is one of the upsides about being the way I am. One of the things I love about my autism is I'm not so easily offended as most people. You can say things to me that would get most people like really white hot enraged, and I'm just like, that's a weird opinion you got. So I'm pretty go with the flow kind of person. And some of the more notable friendships I've made in my life is people that I saw that was just rubbing everybody around them the wrong way, and was just and everybody just hated them, was always against them. And then they would throw some of that venom my way. It doesn't bother me in the slightest. I talk to them, get to know them. And next thing I know, they think I'm the best friend they've ever had. And they're complaining to me about how like I'm the only decent human being on the planet. And I'm like, you are aware that like the way you talk to people is really insulting. This is why everybody's angry at you. And they're like completely unaware. And they're like, that's like a word from the mountaintop. It's not something that they'd ever considered. Sometimes when your feelings are hurt or when you're offended, like if that person is doing it with intent, yeah, absolutely. You should come down hard on that. You should defend yourself. You should stand up for yourself, but you should have a little voice in the back of your head that says maybe the way that the way that they're able to say that so callously is they just have no idea. Especially if you're like, oh no, there's no way, they absolutely have to know right from wrong because this is so obvious to me. It has to be obvious to them. That's a really good sign that you're not respecting the fact that they could be neurodivergent and they could be wired a different way. Now, those of us who are like stomping on feelings everywhere we go and stuff, we do need people to come to us and pull us aside and say, hey, the way you said that, you can't say that way. That's very, very hurtful. We need to be taught that. You know, I'm only as good at social interaction and being able to get along with people. You know, the biggest tragedy of my autism, and I love the fact that I'm autistic. I love my autistic brain, the perspective. There's so much, like, you couldn't get rid of my autism without murdering who I am as a human being. I would not be me without my autism. It's an important part of who I am. It's the same is true for my kids. But one of the greatest tragedies of my autism is that throughout my life, I have really hurt people and really offended people and really upset people and just had absolutely no idea what I was doing. It was through pure ignorance. And I'll give you a great little example of that. As 19 years old, I was a soldier. I was in my apartment, and a young couple living next door. The 18-year-old wife had just given birth to a baby. It was a really difficult birth. They had to use that suction thing. You guys ever see the movie Alien? The shape of the head. This baby's head was shaped like that, but sideways. So newborn baby with a banana shape. Now, 6 months later, the baby's perfectly fine. Baby perfectly looked normal. You know, it's malleable. It can. Yeah. But she comes into my apartment right home from the hospital with this newborn baby with the banana head and walks right up to me and says, "What do you think about my baby?" And I glanced over and said, "Oh my God, that is the ugliest thing I have ever seen in my life." And she burst into tears and she fled the apartment, and that shocked me. And I spent several minutes trying to go over what just happened and try to figure out, why did she break down crying and flee from my apartment? I had no idea. It didn't make any sense to me. But so much of human interaction didn't make sense to me. So I'm always writing these little algorithms. And I was like, all right, so the next time someone asks me about their baby, I'm going to go, and like not say anything. That's probably the safest thing that I could do, because I just couldn't figure it out. It was years and years and years later that I finally understood how most people think and how they interact. When I understood that you guys don't use language properly and you say one thing and mean something else, that I realized that she didn't actually ask me, "What do you think of my baby?" What she was actually saying is, you know, I just got home and here is my child. That means everything to me. And I'm feeling kind of vulnerable right now. And I need another member of my tribe to acknowledge that this baby is a part of our tribe and this baby has value with us. That's what she was really asking. And callously, I just said something else. Like, when I finally understood what I had actually done to her, it's still difficult to this day for me to think about it, realizing how much hurt I have done unintentionally. And that's the greatest tragedy about my autism, is that I can upset and offend and just do the wrong thing at the wrong time, or not do the right thing when it's absolutely appropriate, just because it's hard for me to figure that stuff out. And so I put all this work and effort in being able to better socialize and being better able to communicate, because I just want to be a decent human being. I want to do my part as a part of the species. And I think a lot of Aspies are kind of like that. And so, you know, instead of hitting those people with anger or hatred or pushing back, like a little patience, a little understanding, and some just frank, open, honest communication. If you think you're speaking to someone who's neurodivergent, the best advice I can give you is that when you're communicating with them, imagine that you're texting and you don't have emojis. So you can't say things and then put a raspberry at the end of it or something, right? You have to be careful with your wording. You have to make sure that when you read the sentence out without any emotional inflection or anything like that, it says exactly what you mean. If you think you're talking to somebody who's wired differently and you're just a little bit more careful and considerate with your language, you might be surprised at how quickly you're able to form a two-way dialogue. And once we're talking to each other in a way where we can understand each other, a lot of these problems tend to go away.
Thank you so much for that. Thank you all of the panelists for joining us today. Dave, Brianna, Vanessa, and Julia. I think you've really set the tone for us for the month, because as we end, what I heard you say was be decent people and learn how to communicate clearly. And I think if we could just do that in everything, our lives would be so much better, just as an entire community. Be decent people and communicate clearly. So at some point, we're going to have a conversation about how to have difficult conversations. So excited about that. But thank you for talking to us, teaching us some things, teaching us how to be good allies. and how to be supportive of one another. If you all have any questions, you can put those in the chat as we close. And I can forward those to the panelists and have someone reach out to you with answers, because we did not have enough time for the question and answer session because of our technical difficulties. But join us again next week when we talk about diabetes and hypertension. Thank you for joining us today, and have a good rest of your day. Thank you.
Thank you.